Testosterone crisis. Testosterone is the fuel of our body and a hormone of vital importance for our metabolism. As in many subjects related to male sexual health, this is a razor-edge topic with many widely misunderstood aspects. Should one take testosterone supplements or not? What are the risks of taking it or avoiding it? What is the connection between testosterone and andropause? I will answer many important questions such as these. Do not forget to watch the video until the end, like it, and share it. Once again, I am here with a very special, information-packed, and unique presentation. Testosterone and estrogen are the two main sex hormones in mammalian species, and they are molecularly very similar. As you already know, testosterone is the dominant hormone in men, while estrogen is dominant in women. However, just like in the yin-yang phenomenon, a small amount of estrogen exists in the blood of men and a small amount of testosterone exists in the blood of women. These minor hormones are balancing elements for our metabolism, sexual health, and mood and functionality begins wherever balance exists. In this video, however, I will specifically address the importance of testosterone for men. The testosterone hormone, or more accurately, the androgenic male sex hormones, are produced at a rate of 90% in the testes of a man. A small portion of about 10% is secreted by the adrenal glands. This 10% production is insufficient in terms of bioactivity and volume. Therefore, testicular health is extremely important for testosterone production. Inside the testicular tissue, testosterone is produced from the cholesterol molecule through a series of enzymatic processes within the cells called Leydig cellae. Thus, cholesterol is the raw material, and excessively lowering it for cardiovascular health may negatively affect testosterone production. Testosterone has four main areas of function in our body, all of which are vital for the individual. 1. Sperm production. 2. Sexual functions. 3. Metabolism. 4. Psychological stability. Testosterone is produced in the testes, and its first area of duty is again the testes. For the initiation and continuation of sperm production, called spermatogenesis, testosterone is required. If testosterone production decreases, sperm production is disrupted and infertility may arise. After testosterone is produced in the testes, it passes into the bloodstream and binds to carrier proteins such as albumin and SHBG, spreading throughout the body via the vessels. There is a one-way barrier inside the testes. Testosterone exits the testes but cannot re-enter. Therefore, externally administered testosterone will not have a positive effect on the testes and will not contribute to sperm production. On the contrary, it may disrupt a system that is functioning in a healthy manner. Testosterone that enters the bloodstream can then easily pass through the blood-brain barriers and penetrate neural tissue. There are especially dense testosterone receptors in the hypothalamus and limbic regions of the male brain, and testosterone exerts its effects by binding to these receptors. Sexual desire, drive, motivation, and libido originate from this testosterone hormone. When testosterone decreases, sexual desire in men may decline. Along with decreased desire, a man's sexual confidence and courage are also weakened. Testosterone affects the male's secondary sexual characteristics such as muscle mass, body hair, beard formation, and deepening of the voice. If testosterone is low, muscles and bones weaken, and general body endurance declines. Body hair becomes sparse, abdominal fat increases, and a sleepy, easily fatigued, sluggish male profile emerges. This condition leads to the appearance or worsening of other metabolic diseases, such as elevated blood glucose and lipids. Thus, the control of chronic diseases becomes more difficult even when medication is being used. Maintaining testosterone levels is therefore essential for healthy aging and longevity in men. On the other hand, Testosterone is also very important for male psychology. If testosterone is normal, the man is more emotionally balanced. He can think clearly and make healthy decisions. Low testosterone leads men into a more angry, irritable, sharp-tempered, psychological state with reduced cognitive clarity and impaired memory. Cognitive functions deteriorate, and men may experience frequent anger outbursts. This can cause harm both to themselves and to those around them. I am sure there are a few grumpy elderly men in your environment. This may actually be a sign of low testosterone. Testosterone hormone measurements must be taken in the morning on an empty stomach at a reliable laboratory. If total testosterone is low, a second test must be done, and free testosterone must be calculated. In this way, the most accurate result can be reached. In the last 10 years, hormone therapy, or testosterone replacement therapy, TRT, has become a widely discussed subject even in healthy men. In other words, can we elevate testosterone to increase metabolism and thereby help men live longer and healthier lives? This is still a matter of debate in the medical community. The advantages and disadvantages must be carefully evaluated. The main problem, in our opinion, is the misuse of testosterone supplements by young men. Let us first discuss this topic. We frequently encounter young men engaged in heavy sports who pursue larger arm muscles, and unfortunately, many of them administer high-dose injectable testosterone supplements. Along with this come protein powders and high-dose vitamin supplements. Yes, the visible results are obvious. However, they are taking a huge risk, and most of them are aware of it. They assume they can quit whenever they want. Yet these hormone supplements taken without medical necessity, just for bodybuilding, can cause many side effects. 1. Natural testosterone production is suppressed at the hypophyseal level in the brain, and the testes stop producing testosterone. Therefore, sperm production ceases, testicular volume decreases, and consistency deteriorates. Even if supplementation is discontinued, the damage may be permanent. In other words, if the hypophysis stops functioning, restarting natural testosterone production may become impossible. Permanent infertility can occur. 2. Externally administered testosterone is not biologically equivalent to natural testosterone and never as effective in sexual function. It only enlarges muscles. It will not contribute to penile function or erection. The exaggerated confidence it creates may later cause performance anxiety and psychogenic erectile dysfunction when testosterone is discontinued. This may lead to testosterone addiction. 3. As with everything, excess is harmful to the human body. High doses of testosterone can stiffen and narrow blood vessels. This may result in early-age myocardial infarction, stroke, or fatal complications. In other words, the risks of death and permanent paralysis are real. Although access to such hormone supplements is limited, young men still find ways to obtain them. Particularly, we are frequently encountering Iranian-origin testosterone preparations. Recently, I absolutely cannot recommend these drugs to young individuals, and they should discontinue them under medical supervision as soon as possible. Another subject is age-related testosterone decline in men. We call this late-onset partial hypogonadism, or Padham syndrome. We know that after age 50, testosterone production naturally decreases by 1 to 2% per year. In some men, this decline is faster and may lead to several health issues: reduced libido, decreased erection quality, fatigue, irritability, and frequent mood deterioration. May be signs of low testosterone, and testosterone levels should be checked. We recommend that testosterone levels in men over 50 be measured annually, just like PSA. The results must be interpreted by considering the patient's age. The threshold level of an 80-year-old man is not the same as that of a 50-year-old. Once testosterone deficiency is verified twice and symptoms are present, we may begin testosterone therapy. The safest method is transdermal gel or cream preparations. If testosterone is very low, below 200 nanograms DL, creams are often insufficient and injectable forms may be required. Oral testosterone supplements are generally not preferred today due to their side effects. In the last decade, TRT has also become popular in men whose testosterone levels are normal but low normal. The goal is to accelerate metabolism, strengthen muscles and bones, and enable healthy aging and prolonged lifespan. While the theory is logical, TRT remains controversial and must be evaluated carefully. This approach is not synonymous with hormone abuse. Nature itself gradually reduces the reproductive and metabolic capacity of aging men. Unlike menopause, male reproductive function continues until death, though diminished. One might see this gradual hormonal slowdown as a form of evolutionary clearance, making room for younger males. However, one could also argue that supporting aging men hormonally might benefit modern human life, considering that reproduction rates are declining and healthy, capable older men are still needed. Yes, this logic exists, but we still cannot say, let us give testosterone to everyone. The ideal TRT candidate is a man with borderline testosterone, a healthy cardiovascular system, and low prostate cancer risk. For this reason, urological and cardiological evaluations are mandatory. With medical supervision, TRT may be recommended after weighing pros and cons. Now, let us move on to widely misunderstood issues and common myths. 1. If a young or middle-aged man has erectile dysfunction or low libido, and testosterone is found to be low, the cause is testosterone deficiency. No, low testosterone is not the cause, but often the result. In a healthy man, testosterone does not suddenly drop for no reason. Sexual problems themselves suppress testosterone production at the brain level. Therefore, many men with sexual dysfunction have slightly reduced testosterone. This can mislead physicians. However, when sexual dysfunction is treated, natural testosterone may rise again. The psychogenic or relational aspects of sexual dysfunction must not be overlooked. 2. The higher the testosterone, the greater the sexual power. No, every machine has a fuel tank, and overflowing the tank does not help but harms. Excess testosterone does not create excessive sexual desire. Surplus testosterone is converted into estrogen in fat tissue and may cause gynecomastia. 3. Testosterone supplementation causes prostate cancer. No, it does not cause cancer. Low testosterone may even increase prostate cancer risk. If you do not have an active prostate cancer or strong family history, there is no need for concern. This risk must be evaluated with your urologist. If no risk is detected, testosterone may be used safely. 4. Andropause means a drop in testosterone. No, there is no true medical condition equivalent to menopause in men. Andropause is more a psychological outcome of aging and may not be strongly related to testosterone. It can be considered a behavioral state in men dealing with aging, sexual decline, and fear of death. In some men, libido increases, in others it decreases. Testosterone is only one part of the picture, most of it is psychological. 5. Excess testosterone causes baldness, or bald men have stronger libido. No, baldness is caused by dihydrotestosterone, DHT, a derivative of testosterone. DHT receptor sensitivity is genetic. The presence of baldness does not indicate higher libido. DHT receptors are present only in the prostate and hair follicles, nowhere else. It is a hormone with no other useful roles. 6. testosterone supplementation or suppression can change a man's sexual orientation. No, sexual orientation does not change. At most, existing desire may increase or decrease, but orientation itself does not change. 7. Testosterone can be stopped whenever desired. No, restarting natural production is sometimes not possible if the hypophysis has been suppressed. Lifelong hormone use may be required, and this brings risks. 8. I stopped seeing morning erections. My testosterone must be low. Most likely, no. Testosterone must fall below 150 to 201 gdl before morning erections are affected. Morning erections are a parasympathetic discharge at the end of REM sleep and do not need to occur every day. Occasional occurrence is sufficient. 9. Increasing testosterone enlarges the penis. No, never. External hormone administration does not enlarge the penis. Penis size is a genetic condition and cannot be changed. Only in congenital hypogonadism treated during puberty can normal penis size be achieved. 10. Supplements marketed as nutritional support can increase testosterone. No, popular supplements have not been scientifically proven to increase testosterone in humans. A placebo effect may cause motivation and a slight testosterone increase, but not from the biological effect of the supplement. Long-term or high-dose use of such supplements may even pose potential risks. Low-quality biased studies should be viewed with skepticism. So, is it possible to boost testosterone naturally without medication? Not as much as hormone therapy, but to some extent, yes. Especially competitive exercise or at least brisk outdoor walking, losing weight, regular sleep, balanced vitamin-mineral support, such as vitamin D, zinc, and selenium, avoiding smoking and alcohol, and a Mediterranean diet rich in greens and seafood undoubtedly support natural testosterone. On the other hand, increasing sexual activity, pushing the body into action, and including oneself in high libido social environments may be beneficial for some men almost as much as hormonal treatments. I wish you a healthy day.